presenter. Thank you.
Thanks, Kimberly. Thanks for having me this afternoon. I'm very privileged to be able to discuss the special dental needs of those living with clinically severe obesity, which is an often less discussed issue. Next slide, please. When we discuss bariatric dentistry or dentistry for people living with obesity, there's several key areas that this encompasses. So we look at clinical, service delivery, and patient-related implications of obesity. And given the increased risks of medical comorbidities linked to obesity, it's crucial that they have access to not only their medical services, but oral health care services. And this is additionally pertinent given the findings of cross-sectional studies involving people with clinically severe obesity have showed that they have high rates of poor dental attendance, dental anxiety, and poor oral health-related quality of life. Bariatric dentistry also accounts for the emerging evidence between obesity and dental diseases, like increased links between gum disease or periodontal disease and obesity. And the dental professional's role in the dental management of people living with obesity is also an emerging aspect. It may interest you to know that when patients exceed the safe dental chair weight limits, which typically sit around 140 kilograms, but this may be higher depending on the chair model, they require their dental treatment in a bariatric dental chair, an example of which we can see on the right, which can accommodate higher weight limits of up to 455 kilograms. Unfortunately, in Sydney, Australia, where I work, there are only 3 bariatric dental chairs to service a population of more than 230,000 people living with severe obesity. The situation is similar interstate. Individuals can currently require referral to public hospital-based special needs dentistry departments, where these bariatric dental chairs are located. And unfortunately, in turning patients away for their safety, dental professionals may engage in stigmatizing conversations, and this is one example of weight stigma in the dental setting. The key is that not everyone living with severe obesity requires specialist dental management, particularly if they present with stable medical conditions. But given this placement of the current bariatric dental chairs in dental specialist departments, patients are then forced to wait on long public waiting lists and ultimately may only require or receive emergency or needs-based dental care due to limited resources. And on World Obesity Day today, this is a great opportunity to bring attention to this ethical dilemma. Why should a patient find it difficult to receive preventive dental services like a scale and clean on the basis of their weight? And what happens if they're not eligible for public services? We need to be prepared with better solutions. Next slide, please. Previous qualitative research involving the perspectives of 40 individuals living with clinically severe obesity attending a tertiary metabolic health service confirmed a key barrier to accessing dental services was their experience of weight stigma. And this is sometimes even before they met the dental professional, which might have included their initial point of contact with support staff. People living with clinically severe obesity provided numerous suggestions to improve their dental access, including things like increased numbers of bariatric dental chairs, possibly within their medical obesity services, with privacy as a main feature to these facilities. They wanted dental professionals to increase their awareness and knowledge of obesity and provide kinder treatment and take measures to overcome their experience of weight stigma. Next slide, please. However, our scoping review outlined previous gaps in the literature. There were no interventions focusing on weight stigma reduction in the dental setting, and this is particularly needed, as well as continuing professional development in this area for both clinicians and support staff. We're now currently evaluating a weight stigma educational module among oral health therapy and dentistry students, and found it, whilst it was useful and relevant, it did not fully address issues of personal blame relating to the causes of obesity. So like in other healthcare settings, we will likely need multifaceted interventions to address the complex drivers of obesity stigma. Thank you for your attention.